So why do we care? Why should we care about biomarker testing? And here I'm going to tell you a story about something called ALK non-small cell lung cancer, which is something that I'm really very interested in. So ALK, or ALK, stands for anaplastic lymphoma kinase. And in this situation, it is an abnormal fusion. So we talked a little bit about before how two genes come together abnormally and they create this protein. This is what's happening in ALK. Now, ALK is found in normal tissue, but when it combines with a partner, in which case the most common partner is something called EML4, it leads to this abnormal protein that can't get shut down by the body, and it continues to send growing signals. And this is a very common feature of cancer. Now, this fusion was first discovered and published about in just 2007, so not that long ago, and it was shown to be present and important in about 3 to 7% of non-small cell lung cancers. And this is one of our biomarker-driven groups. Now, just in 2014, so 7 years after ALK was discovered to be important, there already was a drug that was developed specifically for ALK, and this drug was called crizotinib. And below, I show you two curves from the study that was done at that time and published in 2014. So on the left, you see that crizotinib was compared to what was considered standard at that time, which is chemotherapy. And here you see that as compared to chemotherapy, crizotinib had a much longer progression-free survival. What that means is that patients who were on crizotinib derived benefit from crizotinib longer than if they were on chemotherapy with respect to the cancer not growing or spreading. However, you see on the right that the overall survival didn't seem to matter. And you'll say, hey, why is that? Why is it that patients can do better on crizotinib in terms of length of how long they're on the treatment, but overall survival appears to be the same? And that's because when patients, if they progress on chemotherapy, actually had a chance to go on crizotinib. But based on this alone, the FDA did approve crizotinib to be the frontline treatment in ALK non-small cell lung cancer. Now, if we fast forward just 10 years, the median progression-free survival has improved from 7 months with crizotinib to now over 5 years. That is right. So on the right is a curve with a drug called lorlatinib, which is what we consider a third-generation drug. So a drug that is even more specific for ALK and has more penetrance into the brain. And we'll see that at 5 years, with 60 months on the x-axis, over half of patients were still on lorlatinib and still had not progressed. That is the progress we have made in 10 years. But we never would have made this progress if we never did biomarker testing and we never delivered the right therapy to the right patient. And this is why biomarker testing is so incredibly important.